We've still got some people joining, so I'll just wait another minute or so. Right, okay, thank you. Welcome to this first webinar about the EDICa's Flexible Fund. We have some slides to show you. We also have BSL interpreting. My first apologies that my internet is freezing up today, so if that's an issue, we will go back on anything I've missed. So let me just share my screen. So we have a Q&A session. You can ask questions at any point during the Q&A session. My name is Kate Sang and I'll be chairing the seminar, but Professor Robert MacIntosh will be chairing the Q&A session. We'll be keeping an eye on those questions. You can also message the hosts and panelists at any time during the chat function. I want to take a second just to go over our code of conduct, which is that we're dedicated to providing harassment-free experiences for everyone. If any harassment takes place, which we don't anticipate it, but if it does, we will take measures to control that harassment, and it may result in somebody being expelled from the event. You can ask Q&A at any time. You can ask with your name or you can ask anonymously. Any questions we don't answer will be shared with speakers and we will answer them at another point. So after this event, we will produce an FAQs and they will go up on the website, and those will be a living document that we can add to as we get more questions going through. Hopefully those of you who need BSL interpreting have accessed interpreting. We have pinned the interpreter as one of the panelists. And you can also access closed captions by clicking on the 3 dots at the bottom of your Zoom screen. If for any reason you're not able to use the Q&A, you can either raise your hand and ask a question verbally or using interpreting, or you can message the panelists to have a question answered. We have 2 interpreters and they will be swapping over at various points during this hour, so we will take a short break when that happens. So this is the first round of our flexible fund. You can contact the caucus anytime using our email address or follow us on Twitter. And what we're going to go over today is just a very brief introduction to the caucus and to the flexible fund, but we're mostly here to hear your questions and develop our Q&A. So just very briefly, we're going to go over who we are, what the caucus aims to achieve, the flexible fund, year 1, our process for the caucus, and also introduce the next flexible fund round, which will be at the end of 2023. So for those of you who aren't aware, the EDICa, or EDICa for short, is funded by UCRI with additional support from the British Academy. This is our management team. I won't go through all the names. I'm Kate Sang, I'm the Principal Investigator and I lead Workstream 1, and Workstream 1 is the first round of the Flexible Fund. We have Professor Robert MacIntosh here, who's Workstream 2, who will be supporting the seminar, but also leading the next Flexible Fund round that comes through. Next week, we'll be running the seminar again with updated Q&A, and that will be led by Jemina Napier, who's a Deputy Principal Investigator, and also James Richards, who's Workstream 3 lead. And I'd like to thank our whole team for getting the Flexible Fund ready, including Lizzie, Fenella, and Rustam. And this is our wider team of co-investigators. And next week, I think it is, we'll be doing our first seminar, which will be chaired by Jason Harday. And these are all our postdoctoral research associates, some of who I think are on the seminar today, and they will play an active role in peer reviewing and processing the peer reviews for the Flexible Fund. We're partnered with the National Museum of Scotland, York University in Ontario, the Summer CDT, so Centre for Doctoral Training, which is a partnership including Heriot-Watt, and also EDICa, which is based at Heriot-Watt as well. So we have partnerships across universities, but also with universities. So the aim of the caucus is to create inclusive research and innovation cultures to enable diverse researchers and innovators to access and thrive in careers. So we're particularly interested in creating the evidence bases to accelerate change, moving towards equity. And this is why the Flexible Fund emphasises impact, but also co-design and working with marginalised researchers and innovators. And the Flexible Fund is a key aspect of creating those evidence bases for what works to create equitable workplaces. So the Flexible Fund is £1 million full economic cost over the 3 years. So we're dividing it equally between work streams. And EDICaucus is managed by the ESRC, and therefore we follow their funding rules and guidelines. And similarly to UCRI, our funding is at 80% of full economic costs. We expect projects to embed co-design and for projects to be led by marginalised researchers and to engage with marginalised researchers. And co-design is, we believe, the best way for creating change, effective change in the workplace. But we also want to see impact. So we want to see impact, for example, we might see changes to practice, to policy, we might see the creation of new evidence bases or a new data set that subsequent researchers can use to accelerate change. So this is the first round of the Flexible Fund. And we've been quite open that this is a new process for us, and we are learning as we go through this process. We may not be able to answer all of your questions today, but we will get back to people to answer questions, and on the website we will have a full FAQs, which, as I say, will be updated as more questions come in. So for year one, the Flexible Fund is focused on workstream 1, and workstream 1 aims to look at the career life cycle. So we're looking at imagining the possibility of a career in research and innovation for those who perhaps have been traditionally excluded. Our particular project's focus will be on menstrual health and perimenopause, co-designing an intervention to reduce the discrimination and barriers faced by those living with problematic menstruation and going through perimenopause. So that's workstream 1's focus. The Flexible Fund for year 1 is looking at understanding and mitigating the impact of COVID on inequalities across the research innovation ecosystem, with a particular focus then on careers, because it's workstream 1. So we have had some questions whether projects will be accepted outside that remit, and we have had proposals sent to us that we're giving feedback on. The deadline for that was the 4th of September. For round 1, it must focus on careers and inequalities in careers, with a particular focus on COVID. Now, that doesn't mean we won't fund anything else, but it has to be focused on year 1. We do expect to see co-design, and it is essential that projects are orientated towards affecting change. The duration of projects is 12 months to ensure that work can be completed within the caucus lifecycle. And we have no set idea as to the size of award. So we have just over £300,000 set aside for this. We have no expectations set on what size of award, because awards will be dependent on the excellence of the project submitted. So I said we had an expression of interest that closed last week, and feedback is on its way to people who submitted ideas to that. And those proposals have been reviewed by 2 members of the caucus to give feedback on how to ensure that projects do meet the needs of Flexible Round 1. The deadline for applications is the 31st of October 2023. So that's the end of next month. When we receive applications, myself in Workstream 1 with the Workstream 1 team will do an initial sifting to ensure that the projects are relevant and adhere to funding requirements. So funding requirements is also ESRC requirements. We will then identify reviewers for each project, and reviews will need to be completed by the end of 2023. So one of the reasons we've asked for people to come forward as potential reviewers early is so that we can complete that process in time. It's not too late to come forward as a peer reviewer, and you can always email the caucus if you're interested in peer reviewing, or share with your colleagues who might be interested in peer reviewing. And part of that process will be ensuring no conflict of interest as well. And we will let successful projects know before Christmas 2023, with a view to projects starting in the new year. So when that one is completed, We will then start year 2, and this will fall under Robert's leadership. So we've timed this so that the applications will come in after round 1 funding decisions have been made. But this hopefully gives people enough time to develop projects and have an idea of what they'd like to do. And in due course, we will share the focus for workstream 2. So we've got some Q&A, some questions came in beforehand. So we're now onto the Q&A section. We've had a few questions in beforehand, but not that many, so there's plenty of opportunities to ask questions. So we've had questions about the focus of research projects. Can projects focus on anything to do with EDI? And our answer is that projects must address the needs of each call. So for example, for this one, it must be workstream 1, which is inequalities across the career life cycle, with priority given to COVID-related studies. And this is why I have expressions of interest, so that we can feed back to people early whether their ideas fit the caucus or do not. And if they do not, then we hope that gives people the opportunity to either reframe their research project or look for alternative sources of funding for their research. Co-design is essential to this kind of process. We provided materials on our website, and I think any of us are happy to chat to anybody who might have some questions about co-design. We know from experience that co-design is essential to creating effective outcomes. This is very much under the banner of nothing about us without us. If you have partners for your research and you find you're struggling to find the right kind of partners, please do contact the team, because we might be able to connect you with relevant organisations. And there may be other people who've come forward looking for people to partner with on a similar kind of topic, and we can broker an introduction. So we've had a question: proposals must engage with or be led by those with lived experience of marginalisation in research and innovation. How will this be assessed? So each proposal will have to submit an EDI plan, and within that it will include details of how you're addressing and how you're led by the lived experience of people with marginalisation, and also through the co-design process. So this will all be assessed through the EDI plan and the research proposal itself. Is the financial competitiveness or value for money of the bid assessed? What is a scoring matrix of that? So this is not a question of competing. What we will look at, though, and what reviewers will look at, as they might do with any project, is: are the costs justified? Are they appropriate to the research proposed? And are they proportionate? So this is not a section that in itself is scored, if you like, but we're looking for the justification of resources to determine that resources will be used appropriately. So over to you, and I can see some questions have started coming in already.
Thanks, Kate. I wonder if we could stop screen sharing and I'll walk us through the questions. And thank you, colleagues on the call, for submitting questions. As you said, Kate, there's a number of them. The first of them from Laura is: can academics be involved in multiple projects that are applying to the fund? So, yes, that's a good question. I don't see why not. This isn't something that we've actually discussed yet as a team, and it's something certainly we can provide some more detail on, but we wouldn't automatically exclude someone from being involved in more than one project, but that's something we'll provide some more information on in the FAQs. Yeah. And I guess for colleagues who are in that circumstance, you might want to consider how the politics and dynamics of that with the other people that you're involved with, but there's nothing to preclude you being involved in more than one application. Thanks for that. The next question is: it's not clear what the difference between workstream 1 and flexible round 1 is, and why are there two topics and how are they related? And so, Kate, I guess part of the answer to that is we're organised into these 3 work streams, and we will have broadly one set of flexible fund opportunities attached to each of those 3 work streams. So Kate's workstream 1 lead, and therefore that's first off the rank. That's where the terminology of workstream 1 and flexible fund round 1 comes from. But maybe you could pick up the question about the interrelated nature of the 2 focal dimensions of the study.
Yeah, so the answer is they're not related. So workstream 1's, our own project, will focus on co-designing interventions to improve the experiences of people managing problematic menstruation. Flexible round 1 fits under workstream 1, but anything to do with the career life cycle, but particularly our emphasis on mitigating the impact of COVID-19 on inequalities across the career life cycle. That's not to say someone might not submit a bid looking at the impact of menstrual health and COVID, because there is a relationship, but there's no preset expectation for there to be a relationship between our own research project and the Flexible Fund.
Thank you.
We've just had a message. If you're needing BSL interpreting, you'll need to pin the interpreter. So I don't know if that, yeah, that's gone into the chat as well.
Yeah. And that might be easier now that we're not screen sharing. So, and thank you to colleagues on the call who flagged that as an issue earlier. Hopefully that's been resolved. The next question in the chat facility is the issue around deadlines for the applications, and it says, due to tight deadlines, are you able to review the application requirements to reduce the burden on participants, such as allowing applications to be indicative of partnerships in the co-design phase at the beginning? And I guess the question is, how close to a firm commitment from, for example, partners do you need at the outset?
So yeah, thank you for that question. There's two parts to that question. I'll answer the second one first, which is building in a costed co-design phase at the beginning of projects. There's nothing to suggest that wouldn't be part of what you build in, because we do ask for a description of your co-design process. So yes, that could be part of the project itself. So that's fine. In terms of indicative partnerships, reviewers will have to be convinced of the feasibility of the work. So if you don't have letters of support from partnerships, the project doesn't have that strength of feasibility. That doesn't mean it's a yes or no, or it's a kind of fatal flaw, but I think it's worth considering that we do have to look at whether this project will be completed on time and whether successful applicants will have access to the right kind of parts that they need.
Thanks, Kate. Next up is not so much a question as a plea, I think. Can we remove all acronyms from ever being used in this project, please? And I guess we are all tied into the habit of using acronyms, and for example, the EDICaucus takes a long time to say, and so we've tended to use the EDICa abbreviation of that, as you can see in our slides. But we would really welcome any feedback from people if particular acronyms are problematic or causing people concern. So we tend to abbreviate from workstream to WS for workstreams 1, 2, and 3, for example. Okay, I don't know if you have any other comments on that.
No, I think it would be useful to know if there's specific acronyms which are problematic, but EDICaucus is difficult to say a lot as well, which is why the project name is actually EDICa. It's not the EDICaucus, it's EDICa. It's not an acronym.
And then next up we have, do the investigators for the Flexible Fund applications have to be based in the UK? And a second question, which is related, which I'll just ask at the same time, which is, do research participants need to be based in the UK only?
So to answer the first question, we are bound by ESRC guidelines on this. So co-investigators, there could be international co-investigators, but the PI would need to be based. PIs, if you've got co-PIs, need to be based in the UK. In terms of research participants, no, they don't need to be UK based only, but remember your research has to provide an evidence base for reducing equity in UK research and innovation careers. But there could be, for example, excellent practice from other national contexts that might be relevant, or there might be international project teams, for example. You might need to speak to people outside the UK. So the answer to that is no.
And I'd also just add to those suggestions, Kate, comparative studies or something might be of interest, so that you can see ways in which the participants might come from a broader base. Next up, we have somebody interested in the results of the COVID-19 survey that's mentioned in the slide deck that you were talking through, Kate, and wondering whether those results are going to be viewable, and if so, when. And that survey is still live, isn't it?
Mm-hmm. So yeah, the survey is due to close on the 29th of September. We anticipate extending that. I don't know if James is on the call, but we anticipate extending that in part because there's strike action planned for that week. So the results of that survey will not be available. Full results will not be available before Christmas, but we are doing interim results, looking to see initially, are there particular populations that we're not hearing from. So, for example, LGBTQIA+ participants are underrepresented, participants of colour are underrepresented, as are interestingly participants over the age of 55. So we will be looking at the data as we go through, and once we've reached 250 responses, we'll be able to provide some meaningful descriptive findings for people.
Perfect. And again, as a plea to anybody on the call, if you have seen the survey call or link on social media, on Twitter or on LinkedIn, please do feel that you can share that across your networks. It's in, I guess, our collective best interest to get the widest range of respondents so that we get the most accurate reading of people's experience. Next up is a question about the Flexible Fund again. Can you submit a proposal that's not based on menstrual health and research and innovation careers, but is only based on COVID and inequalities?
So yeah, I think there's been some confusion here, and that's my fault. I probably shouldn't have mentioned what our own research project is going to be, but our own research project has nothing to do with the Flexible Fund. So the only thing they're connected by is the fact that they're overseen by the same person, which is me, and they're both looking at inequalities in careers. There is no requirement or expectation that applications to the Flexible Fund will have anything to do with menstrual health. So I hope that's clear. We'll make that clearer. And maybe next week when we do the second round of this, I'll take out that bit mentioning our own research project.
And just for completeness, there's nothing to preclude an application to the Flexible Fund studying menstrual health in research or innovation careers, but it isn't a requirement. And then finally, thank you to Dawn and our other participant who flagged 5 acronyms that seem to cause some difficulty. UKRI, so the UK Research and Innovation, ESRC for Economic and Social Research Council, FAQ for Frequently Asked Questions, and then Co-I and PI for Co-Investigator and Principal Investigator. And we'll take those away, and again, maybe by next week's running of the same session, we'll spell those out more clearly in the slide deck. I think that takes us to the end of all of the questions that I can see. If colleagues on the call have any other questions that they would like to ask, please do so. Oh, there's a couple more appeared. So the first of those, the link to the COVID-19 survey has been placed in the chat. Thank you, Lizzie, for doing that. So if people want to pick that link up and use it to either complete the survey yourself or to share it with your own networks or both, that would be very much appreciated. And then finally from Laura again, for evaluative studies looking at previous UKRI projects, should we cost in those previous PIs or can they be a partner in a different way?
So I think I understand the question. So just to be clear, my understanding of the question is, if there's been a previously funded study, an applicant might want to evaluate that study. Whether or not you include, I think, the investigators from that is a question for yourselves. I can't think of another. I think it is just a question for yourselves as to whether they're an active participant in it or whether they're a partner, for example. So if you're going to need their time and you want to cost them in as an investigator, they need to be costed in. If they're a partner, they may be providing their time as an in-kind contribution to the proposal, and you can add that in the letter of support. So I think I've understood your question. I'm looking at Robert. He seems to think I've understood the question as well. But if I haven't, we've got plenty of time for it. Yeah.
I had the same interpretation of the question, Kate, and a third possibility, which is you might be evaluating a previous project or intervention as part of your proposed work, and the people who conducted the original study, PI and or others, could simply be participants in your study. You might be reaching out to interview them, for example, as opposed to having them as a co-investigator on your current project. So I hope, Laura, that is the right interpretation of the question that you had asked. And as Kate said earlier, if there are follow-up questions, we will be collating a set of frequently asked questions to share publicly with people after these sessions. And so if there's anything that's unclear in this answer or any of the others, please feel free to reach out to us, and we'll make sure that we put those answers into the public domain.
So Laura seems to have said we have understood the question. which is good. There was a question about accessibility, or a comment about accessibility. I think Lizzie's answering some of those. There's a question of, can we put in an application so we've not put in an EOI? Yes, the answer to that is yes. From next call onwards, it's going to be compulsory to submit an EOI, but it hasn't been this time due to time constraints. Someone else has said, I sent my acronyms again, expression of interest, but did not receive any feedback. As I said, feedback is on its way. Okay, so the expression of interest only closed last Monday, but we have got feedback on its way. And I think we will do our best with acronyms, but spelling out UK Research and Innovation Service, Economic Social Research Council, frequently asked questions all the time, could be problematic, but I think it's helpful if at least on our website we spell out what we mean by those. So we've still got quite a lot of time. Go on, Robert.
On the website, we could create a repository of these acronyms so that, and hyperlink to them so that people can navigate them. But I agree with Kate that it's almost inescapable that there are some acronyms, otherwise the text becomes very lengthy. So for colleagues on the call, thank you for the questions received so far. Thank you to our BSL interpreting team. I suggest that we just take a little pause in case people want to formulate any new questions, and you can either try raising your digital hand and we could come to you, or you can use the facility.
There was a question in the chat.
So will the proposals be blind reviewed, Kate?
So I think we have to be realistic enough, and if we're having an EDI plan to describe your role, etc., it's going to be very difficult to completely blind those peer reviews. So the answer to that is we will do our best, but it's not going to be completely possible. We do have an EDI survey because part of what we have to do is monitor equalities and inequalities with the flexible fund process. That EDI survey will not be linked to the proposal. It's simply for us so we can monitor, are there populations which are more likely to apply, populations which are less likely to get funded, populations we don't hear from at all, etc. But there will not be a relationship between the EDI survey and the application. We will need to report back to the funder certain HESA related data. So for example, number of proposals, men, women, etc. But it's not going to be linked to the proposal itself. Robert, was there anything else you wanted to add under that?
No, I think that's exactly the right sentiment, Kate. We're clearly aware that as a project team addressing EDI issues, we want to try and treat applicants and make decisions in ways which represent best practice. And however, it is not always going to be straightforward in a relatively small community to completely anonymise applications, and there might be aspects of your application itself which name partners or others. And so rather than tying ourselves in knots, we'll do our very best, and we will reflect on that and look as we move from the first time we do this flexible fund work to the second round to see if there are lessons that we can learn about how to do that effectively.
I think it's also worth saying that one of the projects for the caucus, which Robert's leading, is how to reduce bias in the peer review process for applications. So we're also a research site ourselves. So yes, this is something that will evolve as the caucus goes on.
So another question, just a comment on the COVID-19 survey. It seems a bit difficult at the moment to answer from the perspective of a university-based knowledge broker with the options available, as well as for those with hybrid research professional careers. And just before I come to you for a comment on that, Kate, I guess we are aware as a caucus project team that we're covering the research and innovation landscape, and that not all research and innovation happens inside universities. There's lots of other settings in other sectors where research and innovation careers happen. Thank you for flagging that as an issue of a challenge. And as Kate said in the chat, James Richards is the person leading the COVID-19 survey. And so James, as his contact details in the chat, and anybody who's got specific questions, either of that kind of helpful, constructive type, or of any other opportunities or conversations or wants a follow-up, I would suggest reaching out to James direct.
I think I could also say as well that the survey is only one part of that study. So there's going to be interviews and focus groups as well, because by the very complicated nature of people's careers, how they might have moved careers during the pandemic, etc., we cannot cover everybody's experiences in the survey. So I've put James's contact details into the chat, because there will be qualitative phases, and some of these issues are going to be far better addressed in a qualitative phase rather than quantitative in a survey.
So next question, or next comment, does the career life cycle start with students or with people at the beginning of their working career life? And I guess I'll make a start at that, Kate, and then come to you for comment. I guess for me, there's an inevitability that the early part of one's journey into a paid research career is often in some form of student journey, whether that's as a doctoral student or some other kind of student. And so I would be interested in keeping an eye on people's starting of their career, as well as their retention in the research or innovation career. And of course, if you broaden, go back to my earlier comment, and broaden to the innovation sector rather than just the research sector, there will be people who are non-students who may come into that, but they will often have had some student journey into innovation in the first place. Anything you want to add to that, Kate?
Not really, except that when I had my apparently confusing slide up about workstream one of the bullet points was imagining a career in research and innovation. And so that means that we're interested all the way through the point at which people might start imagining that. And that's one of the reasons we're partnering with the National Museums of Scotland, is because at some point school children have to decide their hires, their A-levels, etc., decide what they're going to study at university and decide what they're going to do next. So yes is the answer to that question. In terms of working within the sector, we would consider PhD students to be working within the sector. But yes, we're interested in anything. So for example, did the COVID-19 pandemic affect the career choices that people might have made about moving into research and innovation? As an example, I could see for some people it might have inspired them. In other ways, it could have had other detrimental impacts. But it's very much focusing on a career in research and innovation. So less about, for example, the impact on the student experience or the impact on the classroom experience or impact on assessment. It's retaining a focus on career in the research and innovation sector. So the reason we're setting these things out is we don't want people to spend time writing a proposal. We all know how long it takes, only for it not to meet the requirements and to be sifted out at that early stage. So yes, that was a very long way of saying yes, as long as you retain a focus on research and innovation careers.
And just to pick up that last point you were making, Kate, I think that the expression of interest phase could be interpreted as an additional barrier to make a complicated process even more intimidating. And it is genuinely intended as a helpful and quick set of early feedback about the likelihood of an alignment between the interests of that piece of flexible funded co-designed research and the outcomes targeted by the caucus as a whole. And clearly, if they're completely and utterly on a different page, you would be better to know that. But the intention of the expression of interest and the feedback that we're preparing to send out to the people who've engaged in works in the flexible round one is to try and give a steer or some advice on how to think about improving your chances of success.
So the next question, Robert, which is not the first time we've been asked this question.
Yeah. I've never heard the word caucus in research. Could you please define? So I'm going to give that to you, Kate.
So I noticed that Gabby, who's the investment manager for ESRC, is on the call, and it was the funders that came up with the term caucus. If you're going to ask me to define the word caucus, I'm going to tell you that I can't off the top of my head. But for us, it means not just creating evidence spaces, but also being a contact point, a discussion point. We'll have discussions within the caucus and discussions with the community about best practice in terms of creating equity or overcoming inequalities in research and innovation. So that's not a very good answer to your question, but just being completely honest, we didn't come up with the term caucus. It's also an odd word to keep saying, which is one of the reasons we have EDICa.
and I'll offer my equivalent answer, which is, it is a word which I've heard of, but not often in the context of research or innovation careers. It tends to be more associated with political processes. But the phrase that you used, Kate, that I think is most important is around community. And so the ethos in our particular research caucus is around co-design and about participatory research, and that does genuinely try to get at a sense of community, both in terms of people who are already in the research and innovation systems of the UK, and in trying to work in an investigative way to try and understand where people are either excluded or self-selecting not to become engaged because it just doesn't seem attractive or welcoming enough. So I would, that's not a very clear Oxford English Dictionary definition of the phrase caucus, but I think it is intended to connote this sense of collaborative, communitarian, with a permeable boundary between the practice that we're trying to influence and the research. So research with rather than research on. And maybe by next week we'll have looked up the Oxford English Dictionary's definition of caucus and made a slide for them. But thanks for the question. So to colleagues on the call, we've been going for a little while now. Very happy to stay on and answer any further questions. I would also welcome any feedback on whether this process has been useful and how we might improve it in terms of the quality of the information or any issues around its accessibility. We've picked up the point around acronyms. Are there any final questions that people want to ask in the Q&A facility? I see a digital hand gone up from Amy.
Hi, sorry, I don't seem to be able to use the chat function.
That's okay, Amy. Want to ask your question live?
Sorry, it was just a request. Can we not use blind peer review? We should be using anonymous peer review.
In terms of the terminology we use, Amy?
Yes, in terms of inclusivity and not ableist terminologies. Thanks.
No, that's a great point. Thank you for that, Amy. We will pick that up going forward. Any other final comments or questions? In which case, I think we will draw this first of these seminars to a close. Thank you very much for coming along. I hope you found it useful. Please feel free to reach out either to the EDICaucus web address or to myself or Kate direct, or to James, whose contact details are also in the chat. I guess we could put our contact details into the chat directly. Lizzie, if you could do that whilst I'm doing closing comments. We will be running another of these sessions next week, and we will have a repeat of this process when the second round of flexible funding comes on stream later this calendar year, but this side of Christmas. Thank you very much for your time today. Kate, I'll just pass to you to make some closing comments and then we'll draw to a close.
Yes, I wanted to thank everybody for coming along and for your questions. As I said at the start, this is a learning experience for us and the wider community as well. We won't get everything right first time, so it's really important that you feed back to us anything you feel that could be improved. Please do get in touch. If you've got any follow-on questions, it's quite possible after this you'll think, oh, I wish I'd asked, if anything like me, you'll wish you'd asked a certain question or you'll have time to process it. As I said, we'll have an FAQs on the website, which will be a living document that we'll add new questions to. And this recording will also go up for people to see, particularly with a BSL interpreting on it as well. So thank you very much. I'm not seeing any final last minute questions, just a thank you, which is very nice. So thank you very much. And some of us who are on this call will see you next week. Thank you.
Thanks, folks. Take care.